let's continue with expression of placental syndican 1 and the effects of metformin in normal and diet-treated gestational diabetes mellitus pregnancy, presented by Ms. Boonyada Trangadisaikul.
Good afternoon, everyone. My name is Boonyada Trangadisaikul, and today I'll be presenting about the expression of placental syndican 1 and the effects of metformin in normal and diet-treated gestational diabetes mellitus pregnancies. So, the glycocalyx is a layer of macromolecules, including proteoglycans and glycosaminoglycans that coats all endothelial cells, and they play a role in vascular permeability. Endothelial cells in the placenta are the syncytiotrophoblasts, which are connected to the maternal circulation, and the fetal endothelium, which are connected to the fetal circulation. In gestational diabetes, or GDM, there is a state of hyperglycemia, hypoxia, and increased inflammation, all of which could induce glycocalyx shedding. Syndican 1 is a main proteoglycan in the glycocalyx, and it plays a role in vascular endothelial growth factor regulation. And placental pathologies in diabetic pregnancies, such as increased angiogenesis and endothelial permeability, have been linked to increased vascular endothelial growth factor signaling, suggesting that association between syndican 1 and these placental pathologies. Research has shown association between diabetes and glycocalyx degradation, but the mechanism is not yet known. Comparing syndican 1 expression in placentas of normal versus diet-controlled gestational diabetic pregnancies may give further insight into possible altered protein expression that could be related to the observed placental pathologies. Additionally, metformin has been known to restore the glycocalyx, but the specific effects on syndican 1 have not been studied. So this project will investigate to what extent metformin can affect syndican 1 expression and consequently glycocalyx function. So the first aim was to compare syndican 1 expression in the syncytiotrophoblasts, or what I will refer to as villus profiles, and the fetal endothelium, or what I will refer to as vascular profiles, between normal and diet-treated GDM placentas. And the second aim was to compare syndican 1 expression in placental tissues treated with and without metformin in both normal and GDM diet placentas. And like the first aim, both villus and vascular syndican 1 expressions were analyzed. So what I did was tissues from 5 normal and 5 GDM diet placentas were collected, biopsied, and immediately fixed in paraformaldehyde. Data from these samples will address the first aim. And additional tissue biopsies will be cultured in metformin, either with or without, for 24 hours and then fixed. And data from these explants will address the second aim. The tissues were then cut into sections and then subjected to immunohistochemistry and viewed under fluorescent microscope. And pictures were taken using systematic sampling. Mean percentages of villus and vascular profiles positive for syndican 1 were calculated for all study groups. It was found that there was no significant difference in both villus and vascular syndican 1 expression between normal and GDM diet placentas, suggesting that mechanisms other than syndican 1 expression could be contributing to these placental pathologies and are worthy of further investigation. It could also be that in milder stages of GDM, diet control may be sufficient in limiting placental pathologies. There was also another finding was that there was a significant increase in villus syndican 1 expression in the GDM explants incubated with metformin, suggesting metformin's restorative roles on the glycocalyx, as previous studies have suggested, and its potential in reducing placental complications and therefore birth complications. And lastly, there were no significant differences in both villus and vascular syndican 1 expression between normal placentas incubated with or without metformin. But this was to be expected, as these normal placentas were not subjected to diabetic insults that may have impacted syndican 1 expression. In conclusion, although molecular mechanisms related to these placental pathologies remain somewhat unclear, it is undeniable that maternal diabetes affects placental function. More research is needed on the underlying mechanisms and potential management solutions that could alleviate placental dysfunction and decrease birth complications. Thank you.
Very outstanding.
Any
questions from our judges?
Is there any explanation why syndicant-1 has been picked to study for as a like main marker for the vascular function of the placenta?
Yes, so syndicant-1 has a chain called heparin sulfate, and what it does is it regulates vascular endothelial growth factor regulation. And so when there's less of this heparin sulfate, the regulation of this vascular endothelial growth factor is, well, it's dysregulated. And so it leads to endothelial function, which is like increased permeability, allowing solutes to flow through without being like, how do I say it? Basically, it loses control of what solutes go through. And also, this heparin sulfate chain also regulates vascular endothelial growth factor function by acting as a reservoir for vascular endothelial growth factor receptor. And so when there's less of this heparin sulfate, the receptor kind of is dysregulated. And so the vascular endothelial growth factor function is not localized, and it causes dysregulation, which also leads to endothelial function, which is the leaky vessels, as I've explained before.
So would you expect the same result to come if you study the expression and activity of VEGF itself, not the syndicant-1?
Oh, I studied syndicant-1 expression, but before I was just explaining how syndicant-1 is related to these placental pathologies.
Do you think it would be the same if you study the VEGF as well? Because if you think that the mechanism is go through the VEGF, isn't it better to just study the effect and the activity of the VEGF directly?
Yes, I think it will also be evident that the levels of vascular endothelial growth factors might be increased because there's a lot of evidence about diabetic placentas that show increased angiogenesis and endothelial dysfunction, all of which relate back to vascular endothelial growth factors.
Okay, thank you so much.
Thank you.